Welcome back to my channel. Today I'm going to be talking about diabetes, which is a condition in which the regulation of glucose within the body becomes defective. Diabetes can affect several different organs and systems within the body, including the eyes, the kidneys, and then the skin/nerves of both the hands and the feet. When the glucose levels within our bodies get to unmanageable levels, these structures that I just mentioned get damaged, and they can get permanently, irreversibly damaged. That's why regular eye tests for patients with diabetes are advised, because diabetes can cause two different types of changes within the back of one's eye. These are called diabetic retinopathy and diabetic maculopathy. Both are potentially sight-threatening, particularly the diabetic maculopathy form of diabetic eye disease. This is why eye tests are advised annually, and regular photographs are also advised based on which part of the world one lives in. Watch this video to learn more about how diabetes affects the eyes. Broadly speaking, there are two main types of diabetes. There's type 1 diabetes, which tends to come on in individuals early on in one's life, and it is exclusively a condition that is attributable to defective insulin production. Therefore, patients need to inject themselves with insulin in order to regulate their glucose levels. In terms of type 2 diabetes, that tends to come on a lot later in one's life, typically in one's 40s or older, and it tends to be associated with obesity. Type 2 diabetics tend to manage their diabetes with a combination of initially diet, and then if diet is not sufficient in terms of controlling their glucose levels, these patients may need to move on to medication, and in some cases they also need to potentially move on to insulin. In terms of type 2 diabetics, they do tend to have insulin within their bodies, but there tends to be resistance to the action of insulin. We do know that type 2 diabetes tends to occur more commonly in those of both African American, Afro-Caribbean, and Asian descent. Some women who are pregnant can also go on to develop gestational diabetes later on in their pregnancies. Gestational diabetes puts one at increased risk of developing diabetes post-delivery. Diabetics can have poor vision due to their diabetic disease for several different reasons. As patients find that their sugar levels fluctuate throughout the day, their vision can also fluctuate. This can be linked to, for example, the lens within one's eye. Basically, the lens within our eyes has a certain amount of fluid around it, which provides essentially the nutrition to the lens, and it also removes waste products. As the sugar levels within our bodies change, the sugar levels within this fluid also change. This means that the balance of sugar and therefore nutrients varies. As this occurs, the lens within one's eye can swell, and as that happens, it means the properties and the focusing properties in particular of the lens change, and as this happens, it means that one's ability to see clearly can also be affected. Diabetics can also develop cataracts at an earlier age in life. If you watch my video about cataracts, you can learn more about what cataracts are. Essentially, cataracts are clouding of the lens within one's eye. We also know that diabetic patients are at increased risk of developing certain types of glaucoma. Glaucoma can also affect patients' eyes in several different ways. and if you watch my video about glaucoma, you can learn everything that you wish to know about glaucoma. If you now look at this picture of the back of somebody's eye, essentially the two key areas I want you to focus on are the blood vessels, which you can see are everywhere within the back of one's eye, and also this area here is called the macula. Diabetes can affect both these areas with potentially devastating consequences. In a nutshell, the blood vessels and their caliber tends to get affected, and basically the blood vessels become leaky. As they do so, blood can start spilling into the back of one's eye, and along with the blood, several other waste products can also be found in the back of the eye. If the blood supply to the back of the eye is compromised, it means that new blood vessels may potentially start to develop. When this occurs, these new blood vessels tend to be very frail and fragile, and because of this factor, they are more likely to leak with either a combination of fluid and or blood. These changes to blood vessels are known as diabetic retinopathy. The other way that the diabetic state of a patient can affect the back of their eyes and therefore their vision is if they go on to develop what's known as diabetic maculopathy. In diabetic maculopathy, this area known as the macula, which provides us with our critical vision, and basically the reason why we see the bottom line on the chart is due to the functioning of this particular very small area of the back of our eyes. If this area is filled with, again, a combination of either fluid and or blood, it means that our ability to see critically will also decline. Not everybody with diabetes will go on to develop these eye conditions. However, they are at increased risk of doing so. The better one manages their diabetes, the less likely they are to develop these changes. As these changes occur to the blood vessels in the back of one's eye, or the macular region of the back of one's eye, the retina will end up getting damaged. And the problem with a condition such as diabetes is these changes may not be reversible. This is why diabetic retinopathy is one of the leading causes of sight loss in working class individuals worldwide. There are certain risk factors that are not within our control. For example, the duration of one's diabetes means that the longer we have had diabetes, the more likely we are to develop diabetic retinopathy. Similarly, for those individuals of African American or Afro-Caribbean or Asian descent, the very fact that they are of these particular race groups means that they are at increased risk of developing diabetic retinopathy. But what one can do to minimize the risk of developing diabetic retinopathy is to control risk factors that they do have control over, such as their sugar levels for starters. Another key component that they can control is their blood pressure, which can intimately be linked to their diet, and also lifestyle factors such as smoking. By controlling the risk factors that we do have some control over, we therefore reduce the risk of not only developing diabetic retinopathy, but also hopefully slowing down the rate of progression. At this point, I would like to mention why it is crucially important to attend for regular eye examinations, whether one is under the hospital eye service or one attends to see their regular optometrist, in addition to having regular photographs as part of a diabetic retinopathy screening service. Because essentially, the earlier that changes are detected, the earlier that potentially lifestyle modifications can be made in an attempt to try and control one's diabetes better, and therefore the treatment accordingly can be planned in a timely manner to minimize any long-term damage that may occur through the diabetic disease state. With respect to diabetic retinopathy, there are different stages. So if you look on screen now, you can see that there's a background diabetic retinopathy stage, and then this progresses through to a proliferative diabetic retinopathy state and also a maculopathy state. The basis of this disease and the disease progression is underpinned by changes to blood vessel caliber, as mentioned earlier. So essentially changes that can occur include a bulging of the arteries. These are known as microaneurysms. You can then get hemorrhaging from these arteries, and also when fluid leaks, these fluid elements are called exudates. This can also impair one's vision depending on where these leakages occur. As the disease progresses and the blood supply gets more and more compromised due to these abnormal changes that are occurring within the blood vessels, the retina becomes more and more ischemic, which means it's continually being starved of oxygen, and as mentioned earlier, new blood vessels will then start to develop in an attempt to try and overcome this condition. But unfortunately, these blood vessels are not of the same quality that already exist within our eyes, and these blood vessels have a greater tendency to leak and cause further problems. And these blood vessels can not only develop at the back of the eyes, affecting vision, they can also develop at the front of one's eye and cause certain forms of glaucoma, which can leave one with a very painful eye, in addition to a very poorly seeing eye. It goes without saying that as the diabetic eye disease state progresses from background diabetic retinopathy changes through to pre-proliferative and proliferative diabetic retinopathy changes, the likelihood of needing treatment also increases and becomes even more paramount in terms of trying to preserve and or save one's eyesight. The key thing to mention with respect to treatment is one needs to fundamentally control their underlying diabetic state. The better one controls their sugar levels, the less likely they are to develop these changes, and the slower the progression of existing changes will be. That's why your GP, your practice nurse, your hospital eye doctor, your optometrist is continually asking you to maintain good sugar levels and good sugar control. As things start to become a bit more serious, one of the mainstays of treatment in diabetic eye disease is the need for laser treatment. Essentially, what laser treatment is doing is the parts of the retina that have been starved of oxygen and are potentially going to go on and produce new blood vessels in order to rectify this situation. What laser treatment does is it destroys these starved areas of retina so that they do not go on to develop these blood vessels. So the treatment does cause damage to the retina in an attempt to try and protect the rest of the retina and preserve vision. The worse the diabetic eye disease, the greater the degree and extent of treatment that will be needed. Of course, no treatment is without its risks, and as the areas of retina get destroyed, the peripheral vision of patients can become affected. In addition to this, one's night vision can also become affected, because within the peripheral parts of the retina, the rods which are responsible for night vision are located, and when one burns these parts of the retina with a laser, these rods also inadvertently get destroyed. Some patients that have diabetic maculopathy may also be offered treatment with injections into the eye, and what these injections are doing is trying to turn off the signals that are responsible for allowing new blood vessels to grow. There's a particular molecule called VEGF, and that stands for vascular endothelial growth factor, and in the presence of vascular endothelial growth factor, new blood vessels will grow. Therefore, the injection has what is known as anti-VEGF to try and counteract its effects. So you may be wondering what you can do to control the risk of you developing diabetic eye disease. Well, there is quite a lot you can do. The first thing you can do is to engage with all of the help that is out there for you. See your practice nurse regularly, see your GP regularly, and see your hospital eye doctor and or your optometrist as advised. They will provide you with the best possible advice in terms of controlling your risk factors. You need to start controlling your blood pressure, your cholesterol levels. You need to start maintaining an active, healthy lifestyle which incorporates a good diet. One needs to stop things such as smoking and control one's alcohol consumption. All of these individual things tied together collectively will allow you to maintain good control of your glucose levels, and as you control your glucose levels, you're more likely to control the potential devastating consequences that diabetes can come with, such as eye disease, kidney disease, and peripheral neuropathy. So I will finish by saying that there are certain things that we cannot control that I mentioned earlier in the video, such as the duration that we've had diabetes for, our ethnicity, for example, and therefore all we can do is control the risk factors that we do have some power and influence over. So if we focus on those, then we will hopefully stand ourselves in good stead. Thank you for watching this particular video about diabetes and how it can affect one's eyes in several different ways. If you do have any questions, please feel free to comment below and I will try my best to answer your questions. If you have found this video useful, please do share it with your family and friends. Please do click the like button and the subscribe button, as subscriptions will allow my channel to grow.